All right. Good morning, good afternoon, and good evening, everyone. Welcome to Global Child Nutrition Foundation's webinar, A Measurement Maze Defining School Meal Coverage. We're so grateful to you all for joining us today, and we're looking forward to an engaging conversation around this topic. Please allow me to introduce today's presenters, including myself. My name is Heidi Kessler, and I'm the Deputy Director of Global Child Nutrition Foundation. I have dedicated my entire career to school meal programs, first in the United States and now globally, because I have experienced the difference that proper nutrition can make on one's trajectory into life. I'm also pleased to introduce my colleague, Dr. Ayala Weinman. Dr. Weinman is an assistant professor at Michigan State University, and she plays an essential and critical role in the global survey of school meal programs. We are also joined today by three experts who will both present and serve as panelists for our question and answer session. We'll hear from Dr. Amberley Ruetz, postdoctoral researcher at the University of Saskatchewan. Eleanor Moorfield, team lead of monitoring, evaluation, and strategic planning at the USDA Foreign Agricultural Service. And finally, we'll hear from Patrick Monjorides, senior project officer and technical lead with the Global Education Monitoring Report at UNESCO. Welcome to you all. A few final notes for our participants. Please type in any questions that you have into the chat. We'll be holding those for Q&A session at the end. And finally, we will be sending out slides and recording to everyone in attendance in case you have to leave a bit early. So without further ado, let's go ahead and get started. Please allow me to begin with a little bit of background on GCNF. GCNF is a small nonprofit founded in 2006, and we help governments around the world build national school meal programs that contribute to their educational, economic, agricultural, and human capital development goals. We work with governments, UN agencies, NGOs, and businesses to help build capacity, share best practices, strengthen supply chains, and increase public and political support for child nutrition programs. We are a very small organization, and we have an extensive international network and a mighty ambition to ensure that school meals sustainably nourish all children, regardless of race, ethnicity, gender, disability, origin, religion, or class, to help them, their families, communities, and nations thrive. GCNF routinely advises governments and other entities in operating school meal programs through consultations and learning exchanges, but our flagship programs are the Global Child Nutrition Forum and the Global Survey of School Meal Programs, and I'd like to touch on them both briefly before we dive in too deeply to coverage indicators. First up, we have the Global Child Nutrition Forum, which has been convened by GCNF for 23 years. It is the largest and longest running annual gathering of leaders of school meal programs. The forum is a peer-to-peer learning exchange and technical assistance conference. It's 4 to 5 days of intensive training, brainstorming, and planning, all directed towards establishing country-operated sustainable school feeding programs. By sharing insights, experiences, challenges year after year, an informal worldwide alliance of leaders dedicated to advancing school feeding has evolved. And as a result, the forum has become a global catalyst for school feeding. Here is where the forum has been held over the years. Our last year's forum, held in Benin, West Africa, saw 44 government delegations in attendance. Please make sure you're signed up for our newsletter so that you can be the first to find out when and where the 2023 forum will be held. The announcement's coming soon. All right, now let me move on to the Global Survey of School Meal Programs, which produces the world's most comprehensive and standardized information on school feeding and associated activities. Designed by GCNF in 2017 and 2018 with inputs from technical experts, including many of you, the survey is implemented every 2 to 3 years. Available in multiple languages, the survey questionnaire is accompanied by a glossary of terms and covers all the topics you see on the screen. Government-appointed focal points gather the information required to complete the comprehensive survey and obtain approvals for the data to be entered into GCNF's dataset for public use. Academics, researchers, practitioners, governments, UN agencies all access the data to inform decisions, publications, projects, and further research. The data is the starting point for some key activities, including FAO and WFP's a global knowledge hub on nutrition standards and guidelines, and the African Union Biennial Report on homegrown school feeding. 70% of the data in the recently published State of School Feeding is actually data collected through the GCNF Global Survey of School Meal Programs. This survey has been supported in part by the USDA and the remaining from GCNF through our own fundraising efforts. GCNF is a trusted, objective, and neutral party. We don't implement school meal programs, nor do we have a vested interest in how a school meal program is described by a government. This is essential for the impartial collection of data. We know that governments are getting more and more comfortable sharing their data in this format, as we saw a 32% increase in country participation between the first and second survey round. Here you can see all of the countries that have contributed data through the Global Survey of School Meal Programs. The latest survey round saw participation from 139 governments, 125 of which had school feeding programs. Across the 125 countries, we captured information on 183 school meal programs. So some countries run as many as 4 or 5 different school meal programs in their country. So collecting data at the program level is important. Across the 2 survey rounds, the GCNF dataset contains information for 155 countries. So thank you for giving me that moment to share that information, and I'm going to pass it over to you, Ayala.
Okay, thanks very much. So let us dive in and open up a conversation about school feeding coverage rates and how these are measured and how we understand these statistics when they're reported. Well, it can set the stage with a question: why bother measuring the rate of school feeding coverage in a population or a country? And this all goes back to the adage, what gets measured gets managed. Country governments want to know the extent of school feeding coverage or the reach of school meal programs within their country in order to understand what's happening, set targets, and track their progress. This indicator also features prominently in the Global Survey of School Meal Programs database, where we have made some decisions about how to construct the indicator, and then we construct it for each country in a uniform manner and report that. It's also relevant for other databases, such as at the World Bank, the Atlas of Social Protection Indicators, which also includes these indicators for each country of the world. And it's relevant for policy analysis. For example, if analysts want to understand the implication or the impact of a difference in school feeding coverage rate, the impact on population level outcomes, such as educational attainment or human capital. We wanted to quickly share some examples of coverage rates and where you might find them in use. So the first example actually comes from GCNF, what we produce using the Global Survey of School Meal Programs. What I'm showing on the screen now are a set of country reports. These are concise fact sheets that we produce for each country in the database. It includes standardized information about what's happening with school feeding in each country of the world. And on the front page of each report in the bottom corner, let me see if I can highlight this. So we calculate the coverage rate in each country in a consistent manner, and then we spotlight that on the first page of the report. So you can see here that the coverage rate in Ethiopia is reported as 6%. The coverage rate in Latvia is 76%. So we can compare these across countries. And we also wanted to share some coverage rates that others use. A really good example is the World Food Programme's report, The State of School Feeding Worldwide. This quote in the blue box comes from the 2020 report. And from that report, a really key takeaway is that 1 in every 2 school children receive school meals. And so that first clause is a coverage rate. 1 out of every 2 is a coverage rate of 50%. We also brought forth an example from a journal publication, from a journal of public health, this one with the orange bars, which these bars indicate the rate of coverage in each country. And the example with the green bars from a really nice publication put out by the African Union in 2021. And here, these green bars, again, they represent the rate of the extent of school feeding coverage in each country, in this case, in Africa. But whereas we're going to see the decisions that feed into these indicators of school feeding are not always straightforward, and they're quite complex.
So let's dive into constructing an indicator. Since we know that we're talking about a rate, a percentage, we know that we're going to want to set up an equation with a numerator and a denominator. The numerator is going to define the number of children that benefit from the school meal program, and the denominator is going to define the population of interest. So let us begin with the denominator. In order to do so, we need to make some decisions about our population of interest. What is going to be the age group that we're concerned with? Is it primary and secondary age children? Perhaps just primary, just secondary? Are we going to consider preschoolers? These are decisions that must be determined and defined. Then, once we know the age group that defines our population, we can consider where they are. Are we only concerned about primary age students who attend school, or are we concerned with all primary age students in the country, whether or not they attend school? Let's see the implications on coverage rates for when we choose different options. So let's say that we want to choose primary and secondary age children. We want to know, out of all the school age children in a country, how many are getting fed? In this way, we would get an answer of 15%. But let's say we're only concerned about children who are actually attending school, those who have the privilege to attend school, that is, actual students. In that case, the coverage rate is 22%. As we're beginning to see, the coverage rate is higher when the population of interest is enrolled students only. But it's important to note that a focus on enrolled students doesn't account for out-of-school children, which in some countries may be significant. If we focus on primary age students, we get 25%. All right, let's look at some examples. So in Latin America and the Caribbean, in this case, we don't see a huge gap between all of those who are in primary or secondary age children and all those who are actually students. But if our population interest is only primary age children or students, we could come up with a coverage rate that is 33% percentage points higher. Excellent. And let us look at Europe. Here in Europe, essentially all primary age students are in school, and therefore there isn't a huge difference between school-aged children or only enrolled students.
Yeah, so I'll just add a comment about this slide. So all of the previous examples were aggregated to different regions of the world, but we also wanted to share some examples of the coverage rate in individual countries when we construct this figure in the same way in each country. So this is just a sort of a random collection of countries. And you can see that for Peru, for Tunisia, for Nepal, they follow the same pattern where the bars are increasingly tall as we move right along the x-axis. The same is true in Romania, where if we were to focus on the population of primary school students, 96% of students in primary school in Romania are reported to receive school meals. This is also a pattern that we see in the United States. And finally, I just wanted to include the example of Croatia because it's actually a little interesting that Croatia is a country that it's one of a few countries where there isn't this discrepancy between the coverage rate depending on whether we focus only on primary school or also open it up to secondary school age.
So there are other components that we might want to consider for our denominator besides age and enrollments. We might want to be thinking about the type of school children that we're talking about. Are we talking about those only enrolled in public school or government aided schools, or are we also interested in private schools? Other things we might need to define or consider regarding our population of interest might be the geographical region. Are we looking over a whole country, a whole continent? Or are we looking in a county, a town, the northern part of a country, the southern part of a country, et cetera? Perhaps it's a set of schools, children within a certain set of schools that we're looking at. Perhaps it's just children of a specific age in a specific grade, such as middle school. And perhaps we're only trying to focus or target children who meet a certain criteria regarding need. That might be income status, that might be nutritional status, that might be something else that could be set and defined by any number of organizations.
So to provide an example, an illustration of the implication of choosing to construct the coverage of school meal program coverage based on the population that we select, what is in the denominator, in this case, whether or not we select, whether or not we view the population of interest to be one that is defined by the level of need. We thought we could bring forth the example of the United States. So in the US, there are 49.5 million children who are of school age. They're of the age where they would attend primary or secondary school. We do have a national school lunch program in the US, and it operates in all public schools, and all public school students who meet income requirements, meaning their household income falls below a certain threshold, they qualify for either free or reduced cost lunches through the program. And we know that 28 million children receive food through this program, either for free or reduced cost, or they purchase it at full cost. So who should be in the denominator? This has a very strong implication for what is the rate of coverage that we arrive at for the United States. If we treat the denominator as all children in the country who are of primary and secondary school age, the US has a coverage rate of 57%. And if we regard that denominator to be limited to the targeted population, which is public school children who are low income, then the coverage rate that we arrive at is 100%, because all such children are eligible for this program. So this question is, we're not going to open this for discussion just now. We will have lots of time for conversation, but this is just for you to think about. Does the answer change? Meaning, does your decision of how to construct this indicator change if your goal is to compare the rate of school meal coverage across countries, including in countries that have programs that operate in different ways? Okay, so now we have been up until now focusing on the denominator of this fraction, and now let's turn our attention to the numerator, the number of school meal program beneficiaries. And here we again have a few decisions to make. Specifically, who counts as a school meal program beneficiary? Is it a child who receives food for free through the program or at a discount? Could it also include a child who accesses food through a school meal program, but they purchase it at the full price? This is relevant in a fair number of countries in the world. Is the definition of a beneficiary any child who has the option to access food through the school meal program, regardless of whether they choose to or not? And we will just share again an example from the United States to illustrate the implication of this choice in the numerator. So again, we know that in the US, there is a national school lunch program. 28 million children receive food through the program. Somehow they access food, often at free or reduced cost. We know that the program operates in all public schools. And all students in public school have the option to access food through this program, even though some students choose to bring lunch from home, and some students do access food through the program. And 90% of children in the US attend public schools. So we have a choice with the numerator. Who should be in the numerator? As we saw before, if we define that numerator as the number of children who receive or procure food through the program, the US has a coverage rate of 57%. And if we define that numerator as the number of children who have the option of accessing food through the National School Lunch Program, that coverage rate grows to 90%. 90% of children in the US attend public school, and so they have the program operating in their school. And so again, for now, a question just for you to think about is, does your answer change if the goal is to compare school feeding coverage rates across countries where school meal programs might operate in a different way? Okay, so at this juncture, or at this spot in the presentation, we have an activity, and I actually need somebody from the audience to volunteer to participate with me in this activity. What we have is a decision tree, and we have a goal to produce a measure of school meal coverage in India. For those of you who don't know, India hosts the world's largest school meal program. It's the PM Poshan program. It used to be referred to as the midday meal scheme. It operates in all government and government-aided schools in the country. So in order to do this activity, I actually need to move back to the outside of the slide presentation mode. Is there somebody from the audience who would be willing to step forth and make some decisions for us about the age group that you want to focus on, the enrollment status, and whether we should be focusing on public and private schools, and just share a decision that you would make and explain very briefly why that is the population of interest that you are interested in. Do we have anybody from the audience who can unmute and help us out with this?
Please be brave. We will call on a friend if no.
Johannes Tesru. Yeah. Are you able? Okay, thanks.
Yeah, I just see that the primary students or preschool students, and then see the enrollment. And then if I see that many people are enrolled, I will just, focus on the enrolled. Okay. And I then go to the public and the private. I see that depending on the, cost of living and the conditions of, the living status of the community, I will try to see and decide. But basically, I will focus on the public because most public schools have, less fee for, payment. That shows you, a little bit on living status. Okay. And then I will just evaluate based on the impact of the meal to the school performance, depending on the.
Okay. So thank you very much for being willing to step forward and share your thoughts. So we you proceeded down this path, focusing on primary age students, focusing on enrolled students, and focusing on government schools. With that set of decisions, the school meal coverage in India is 100%. It is a universal program if we define the denominator in that way. And thank you for sharing your reasoning for following that particular path down the decision tree. Johannes, would you be willing to stay on the line and select an alternative path that is also of interest to you?
Alternative paths.
Meaning an alternative set of decisions. So we'll come up with, we'll end up somewhere else on the decision tree.
Yeah, maybe on the primary or preschools, and then see the enrolled students, depending on the percentage of students and all ages. I just see the number and go to all schools.
Okay. So now, thank you very much, Johannes. So now with this alternative definition, where we've opened up the denominator to all primary schools in the country, the rate of school feeding coverage in India is 55.5%, because lots of students actually do attend private school where the program doesn't operate. So that's quite a difference. Thank you very much for your participation. We really appreciate it. And now I will just share what are the numbers that we would have arrived at if we had made any number of different choices, including whether we thought the denominator should be both primary and secondary school age. And these choices that we made in this decision tree aren't even all of the choices that we really need to make to construct an indicator of school feeding coverage in India. Something that we might also want to think about is the frequency of food provision. So far, the numerator we have treated it as the number of students who receive food, no matter what is the frequency, how often in the year. And many school meal programs provide meals and snacks every school day, but some programs operate for fewer days each week, and some take a different form where they provide take-home rations to students at a less frequency to take home to their families. So from the global survey of school meal programs, we're able to see that among programs that serve meals and snacks, 83% serve food to students 4 or 5 times per week. And that means that 17% of the programs have some other frequency of food provision. When it comes to programs that provide take-home rations, 21% provide the food on a monthly basis. And then I guess that would be 79%. Is that right? 79% that have some other frequency. And another aspect of the frequency of food provision is consistency. Especially in lower income settings, unfortunately, school meal programs sometimes suffer pipeline breaks. These are prolonged disruptions in the provision of food in schools. So this can happen because of disruptions in the supply chain, and it can also result from other shocks like unexpected funding shortfalls that disrupt the operation of school meal programs. So here in green is a quote from a leader in school meal programs from Nepal, and you can see at the bottom that they say, there was sufficient budget to cover 100% of the planned students under this program. However, the actual reach of the program was lower because there was a delay for 5 months in the arrival of food from overseas. So this is just one example, but it does happen that the receipt of food is interrupted sometimes. And so just now to open this conversation, which I hope that people will have their own suggestions and their own thoughts to share on this, we wanted to suggest maybe a new way to measure the school feeding coverage rate that's a little bit more nuanced to account for the frequency and consistency of food provision. So in this example or this suggestion, the numerator could account for the number of days that children receive food, and the denominator might be something like the total number of possible days that children could receive food if all children were receiving food every day that they were in school. So as one example, let's say there's a country that has 5,000 children, and among those 5,000 children, 1,000 of them received food 2 times per week throughout the 10-month school year. So in this formulation of the school feeding coverage rate, the numerator might be 1,000 students. Let's see if I can get a highlighter here. 1,000 students receiving food 2 times per week, 4 weeks per month, and 10 months per year. So there are 80,000 eating experiences that were provided through this program. And the denominator is the total number of potential meal experiences. 5,000 children in the country, 5 days per week that they're in school, 4 weeks per month, and 10 months per year. So in this formulation, the coverage rate would be 8%. And now let's say that those same children experienced an interruption. So in the middle of the school year, there were 2 months when they showed up at school, but they didn't receive food for 2 months. So now the numerator would be adjusted to reflect that. There are 1,000 children in the program, but now they received food for 8 months of the year. So the numerator is smaller, the denominator is still the same because it's the same potential in the country. And now the coverage rate declines to 6.4%. It reflects that interruption that was experienced. So if we were to adopt this measure of school feeding coverage, we would have to collect data on the operation of school meal programs that's a little bit different from the type of data that we often collect, which is asking the number of children who are reached through the program. Okay, so I'm almost done talking. Just the very last comment that there are also a set of decisions that have to be made about the sources of data that we use for constructing measures of school meal coverage. For the numerator, the number of school meal feeding beneficiaries in that standard formulation of school feeding coverage, we could draw on administrative data. The Global Survey of School Meal Programs tries to gather that data, and we will continue to do so. The next survey round will take place in 2024. You can also look to survey data to see if you can construct the numerator from nationally representative surveys. Unfortunately, a lot of the more prevalent surveys don't include questions on school feeding. They could, but they don't. Presumably, either they can't fit it in the questionnaire, or they haven't considered the value of adding this type of information. The Living Standards Measurement Study is implemented in a large number of countries in the world, and sometimes, not always, but sometimes they capture information on school feeding, but even then, they often capture it at the level of the household, and only sometimes do they link it to individual children in the household. So that's the story of data for the numerator. When it comes to data for the denominator, we might be drawing from census data. If there isn't a recent census, maybe we're using official projections of the population in the country. When it comes to school enrollment, we might draw from government reports from the Ministry of Education. And an invaluable resource for constructing the denominator of school feeding coverage measures is the UNESCO Institute of Statistics, which is just a precious resource that we depend on a lot. Okay, so I will stop talking now and we can move on to the panelists who will present their thoughts on this topic, reactions, and share their experiences.
Thank you so much, Ayala. Very happy to transition into our panelists, beginning with Dr. Amberley Ruetz, who's a postdoctoral researcher at the University of Saskatchewan and has been working in Canada and around the world to advance school food and farm-to-school programming since 2015. Welcome, Amberley.
Thanks so much for having me. Yes, so I wanted to start by telling you a bit about what is happening in Canada with school feeding. Unlike most countries, as you saw from Ayala's presentation, we do not have a national school food program. Instead, we have provinces and territories, so our states that provide funding for school meal programs. And, you know, now as of just 2020, every province and territory now does provide funding. But really this started as a grassroots movement of different charitable groups starting up school meal programs. So these free school meal programs. And I note this because, you know, one of the things that we considered here in Canada, and I say we being myself and my co-author, Dr. McKenna, when we conducted the first comprehensive survey of school meal programs in the country. So before we did this, looking at the 2018-19 school year, no one had an accurate number actually on the number of students that were participating largely in these grassroots programs. So I should distinguish, you know, now how we defined this. And a lot of the, you know, things that ILS brought us through really brought to some of those decisions that we had to make here in Canada. So, you know, while we have other programs like the cafeterias offering school meals, those are always at a paid rate. And we wanted to look at defining school meal programs as free programs in schools. So everything including breakfast, snacks, and lunches. So we define this by looking at, as I said, free programs at no cost in junior kindergarten to grade 12 students during the school day and offered consistently over the majority of the school year. And that was an important decision that we made because there are some what are called health promotion programs that offer fruits and vegetables for students to sample. And we felt that that wasn't actually a sufficient, you know, feeding program. And actually the governments themselves said, no, this is a health promotion program, not a school meal program. And then the second or another consideration we looked at was looking at public schools. And the reason we did that in thinking about the prospect of the government doing a national school food program here is we thought, well, likely they would start and perhaps only cover public schools. So that is how we defined school meal programs here in Canada. Now, getting to this notion of coverage, two things broadly were of interest to stakeholders here, and that was the coverage both in schools, so how many schools across the country had a school meal program, both fully across and also within each jurisdiction, so within each province or territory. I won't discuss that in detail today because what I think is more interesting is really the rate of student participation in school meal programs. So some things we came up against is very similar to what Ayala has described, is we noticed in our survey some respondents were reporting on having the option to access. So if the program's there, how many students could walk through the door to receive food? But what we were looking at was the unique number of students participating. And when we first started along this path, we remember thinking, oh, this won't be very difficult to count. And we discovered it was very difficult to count because unlike other nations that have a point of sale, you know, like the United States and others that have swipe cards with students, you know, identification, it's really difficult to track this. So some programs, are using counting number of plates or number of brown bags that go out or are left there. So what we had found is that, counting the number of unique students was not feasible in some areas. Some provinces and territories, even though they were providing funding, weren't actually collating this data at that provincial and territorial level, which is the level of what we conducted the survey. So with that in mind, oftentimes we had a data point of just the number of meals served throughout the year. And the reason why that was really difficult for us to consider school meal program coverage is that it is not uncommon for multiple school meal programs, as we call them, to be in one school. So a student could be accessing just the breakfast, not the lunch, while other students could be accessing both. So it was really difficult to compare across when provinces and territories were accessing different types of data. So that leads me to my last point that I'll wrap up on, because I'm noticing the time, is that there was one province and territory, one province in Ontario where I am based that has been thinking about this problem for a while, as they're one of the oldest funders in the country. And they were recommended to, after a review of the program, they were recommended to consider looking at the average daily participation rate. So because usually meals are counted and it can be across different programs, they had started and moved to counting the number of meals served in a month and divided that by the number of programs operating in that days for that month. So that's another measure that is now being used here in Canada, the average daily participation. So yeah, I'll just close there by saying, there's numerous different ways. And one of the things that we found really helpful, and as Ayala has laid out, is really being clear on these definitions and these different equations, because that can really help to clarify these different ways of looking at what it means to have school meal program coverage. Thank you so much.
Thank you so much, Amberley. That was outstanding. Looking forward to moving on now to Ellie Moorfield. Ellie's background is in monitoring and evaluation, with particular attention paid to M&E capacity in international development organizations. And she, of course, is with the USDA Foreign Agricultural Service. Over to you, Ellie.
Thank you so much, Heidi, and everyone at GCNF for gathering us for this interesting and important conversation today. I'll dive right in just with a little bit of background on my perspective when I'm bringing to the table. I work as an internal M&E advisor for a U.S. government program called the McGovern-Dole Food for Education program. Some on the line may have heard of it. It's a school feeding program administered by the Foreign Ag Service at USDA, and the program uses donated U.S. commodities along with locally procured foods to deliver school meals and to implement complementary activities around the world. To give you a quick sense of the scope of the program, last year in fiscal year 22, there were 55 projects operating around the world in 34 different countries. Those projects for the McGovern-Dole program reached about 4.7 million people, and they worked in about 18,000 schools across those countries. So as an internal M&E team lead, I support all aspects of the monitoring and evaluation system set up for that program. I do need to quickly acknowledge, because again, some people on the line might be aware of this, the projects in that program are funded annually, and the annual notice of funding opportunity called the NOFO is currently open. I won't be speaking today to any aspect of that annual funding process, but it is completely public. And in fact, anyone can also submit a question, an inquiry about that to a public email that will be answered and posted publicly within a week. Certainly happy to share those links should anyone be interested. In terms of the concept of coverage then, when I first was invited to this webinar, I thought, coverage, what's our coverage indicator within the M&E system for McGovern-Dole, right? At the project level, we don't have an indicator that we would call the coverage indicator, right? What's important to emphasize, I think, for me and from my perspective, working at a government agency that's really in the role of a donor across the world, is that the coverage conversation is critically important at the country level in terms of us figuring out as a school feeding actor, kind of what our piece of the puzzle is within a given country. And it's also important at the program level. Our program has been open for just over 20 years. 2022 was the 20-year anniversary of the program. And it can, McGovern-Dole can kind of evolve year to year. We do strive to use evidence to understand what's working and what isn't in terms of school feeding around the world, and to apply that to future iterations of the program. So that's really where I think of coverage. At the project level, we track a lot of data within our projects, and we have standard indicators that are kind of coverage-like or coverage adjacent. We track the number of daily school meals provided to school children, the number of children receiving meals, the number of children enrolled in the specific schools that our projects are working with, and average student attendance. And I do just want to raise that as a related measure in the conversation. Again, especially in places where attendance rates are quite low, that is a factor in terms of our assumptions about whether providing school meals can reach the goals of that activity, right? And in a case where children, for example, are typically attending maybe 3 days a week or whatever it may be. So we measure those at the project level. Our projects are always working in a subset of the schools within a given country again. So coverage is really about us understanding within our scope in a project, how are we fitting into the bigger puzzle of what's going on in this country, and how can we contribute, possibly change what we're doing to contribute better to a higher coverage rate. In terms of what GCNF has proposed and has gone over today, which I found really helpful, a few reactions. First, as an M&E specialist, I'm always thinking, does this indicator make sense? Is it meaningful? And does it also seem feasible on the surface? And for me, the answer is yes to both in terms of how it's been laid out, recognizing there are a lot of maybe different ways, different approaches within what's been offered, right? It does seem practical. It does seem like a program like McGovern-Dole could contribute data, if needed, for example, to that numerator. Two themes, though, really jumped out at me that I think deserve further discussion. The first is meal adequacy, right? And so in that numerator, it almost seemed like we were treating the provision of school meals as a yes or no question, right? But for all of us working in the field, it's not a yes or no question, right? There are so many facets to meal adequacy. Providing school meals is intended to achieve a number of goals for the children receiving those meals, right? I'll also raise, I don't know that there's always universal agreement amongst actors on which of those goals are priorities for a given project or program, right? But meals might be supporting a child's cognitive development, physical growth, improving their health overall so they can attend school more regularly, incentivizing them to attend more regularly, allowing them to pay attention, stay for the full day, pay attention to maximize what's being offered in school, etc. The assumption is that the meal supports those goals when it's adequate, right? And it might not be in all cases. Adequacy could cover the size of the meal, the actual diversity of the meal, even things like, is it being fully consumed? Is there minimal waste? Are all aspects or, all diverse nutritional aspects of the meal being consumed, right? So we know in reality that every meal doesn't meet all adequacy standards. I raise this just to say this is an area where, I'm not questioning whether standards exist. All of us working in the field know there are some standards, but I really do wonder if we were to measure this and use it on a practical level, is there agreement amongst all actors in a given context on whether the coverage rate reflects that threshold of those standards? What do you do in a case where the coverage rate is very low because meals are considered to be maybe 80% adequate, not fully adequate, right? That's something. And what do we do as school feeding actors, right? When we learn that information here. The second theme that I thought was important to explore a bit further, which the indicator does touch on, and I'll just go over this very briefly, is resilience. I appreciated about what's been proposed today that it addressed something like pipeline breaks, right? And to take that further, in reality, there are a lot of issues. Of course, environmental factors. We know of cases where flooding has completely derailed, for example, a national school feeding program, hopefully temporarily, right? But where school meals were not provided, political and economic changes over time can derail even an established program, right? Can cause meals not to be provided consistently or adequately. So this indicator does give us room to talk about those coverage rates going up and down based on shocks and stressors. What this means for me from the donor perspective is that this could be just another way to coordinate amongst various actors in a country, another way to discuss meaningfully in the long term, what can we do differently so that school meeting programs are more resilient, knowing that there will be ups and downs, knowing that this coverage rate, if we don't do much, right, it will be, school meals will be disrupted, right? And knowing that the rate will go up and down, what exactly are we learning about how we can help, within whatever our scope is as various actors? How can we help programs be more resilient to have a more consistent coverage rate in the future? So for me, that was another area for further exploration, but which I appreciated was raised in the indicator. Thanks for the opportunity to comment. Back to you, Heidi.
Thank you so much, Ellie. That was very interesting. Most appreciate your contributions. All right, for our last panelist, I am pleased to introduce Mr. Patrick Monjourides. Throughout his professional career, Patrick has been actively involved with the conceptualization, measurement, and monitoring of international education agendas with a focus on equity in education equity in education and teachers and education in emergencies. Welcome, Patrick.
Many thanks for inviting us to exchange on this occasion. It's a really inspiring discussion. I'm really happy to be here on behalf of Silvia Montoya, the director of the UIS, the UNESCO Institute for Statistics, who wanted to be there but could not attend, and also to represent the Global Education Monitoring Report, which some of you may know is the flagship report monitoring SDG 4. Let me say that really this discussion is for us extremely timely, as the technical cooperation group on SDG 4 indicators, so the education goal, which is co-chaired by the UIS and the GEM report, just endorsed this month the indicator on school meals coverage as part of the global set of indicators to be used for monitoring SDG 4. And this indicator adopted is broadly at the center of the maze that we are exploring today, right? In practice, the choices that were made with regard to that indicator are as follows, and here I will just read what's part of the official layout for the indicator. First, the name is the proportion of school attending children receiving school meals. So it is indeed an indicator of coverage. Then the question is coverage of what is what we may want to discuss later on. And in this definition, the numerator is the number of children receiving school feeding in primary schools, reported by the best available source. And the denominator is the number of pupils enrolled in primary schools of the country as reported by the UIS. So that's the proposal that was made by WFP, and it was endorsed by the TCG this month. And I believe this is one of the successes of the School Meal Coalition and the growing movement behind school meal programs. Of course, the indicator is not perfect, can and will likely be improved over time, but this is definitely a first step to be celebrated towards ensuring greater visibility and accountability around school meals programs, and we are very pleased that it got accepted. Now, if we come back to the discussion, I believe the presentation sets out a very comprehensive set of options to consider. And I think what comes out of the presentation is that basically the methodological choices that will be made, they are intrinsically linked to the conceptual definition that must precede the development of an indicator. In effect, the conceptual clarity, is one of the foundations behind global indicators. For instance, the UN defines 3 tiers for its SDG global indicator frameworks, and a tier 1 indicator is an indicator that is conceptually clear, with available internationally established methodology and standards, and for which data are regularly produced for at least 50% of countries and of the population in every region where the indicator is relevant. But besides that question also of data availability, conceptual clarity or lack thereof is where there may exist differences between statisticians about the choices that are made. So that's really one of my main points here, is that one of the key to find our way in a maze, to come back to the metaphor, is a map. And in this instance, the map is that of policy questions or conceptual approaches, mapping indicator methodology and choices of numerator and denominator. So for instance, in our case, SDG 4, the focus of the school meal coverage indicator is leaning towards public service delivery in school, with the principle that all enrolled children should have equality of opportunities to learn. That's the basic focus of the SDG 4 indicator, right? So we are putting ourselves under this framework, this international framework that has been endorsed by the countries. So we are linking school meal policies mostly with learning conditions, hence the choice of children enrolled in primary education as the denominator. And this is different, for instance, from a focus on policies that would address all children's nutritional status, where we would have probably thought about using all children as the denominator, and not necessarily all children of a given education school age, but all children, period. And then the numerator would have to go beyond school meals, right? Because we're talking about nutritional status as a way to have equality of opportunities in life overall. So one thing to bear in mind here is that variations show, some of the variations shown in the presentation basically reflect conceptual variations, not necessarily methodological issues. And I think that's very sane as part of this kind of debate. There would be a number of other points for discussion, and I believe the various options that have been laid out by Ayala constitute really the first part of that map to navigate the maze. The second part is really to discuss and structure from a policy perspective which conceptual variations are associated with which methodological choices. I can bring two additional points that are particularly important from the perspective of official international statistics. The first one is a methodological one and is about cross-national comparability that we have discussed a little bit. Here I am focusing on the education side of things. Some of the points that were made I very much agree with, but I'm not a nutritionist, so I won't be able to comment too much. I believe the question of what is a meal is an important one that needs to be resolved as well, but I'll just focus on the education part. And during the presentation, it seems to be a given that the term primary education means the same for all countries. Yet we know this is not the case, right? Primary education ranges from 4 years in Hungary, Turkey, or Ukraine, for instance, up to 7 years in Bhutan, Botswana, or Uganda. And sometimes a cycle may not be labeled primary education, but then may be considered as part of primary education as per international standards. So this is why the UIS has a standard way of recording enrollment. So it's using the International Standard Classification of Education, ISCED. But so far, we remain uncertain about this for reporting on school meals, as to be able to standardize against ISCED, you need the data at the grade level. This may not make a big difference at the end of the day, but I just thought I would mention it as this should be considered to have actual correspondence between what is meant by primary in the numerator and what is meant by primary in the denominator. And my last point is more of a political one, also as a way to recall the political nature of measuring. And I will finish on this. Each indicator disseminated by the UIS or international agency is subject to validation by countries. And this is extremely important to ensure the legitimacy of monitoring and accountability, right? So we as statisticians or analysts, we will only have an impact if our conclusion and findings are not undermined by legitimacy deficiency. And it's essential that we continue to involve countries in the discussion and that we also ensure that any methodological decision communicated is communicated and that country teams are also able to implement this in their system. Thank you very much.
Outstanding, Patrick. Thank you very much for that insightful information. And it is indeed very exciting and interesting to know that the World Food Program has put forth the indicator that they have. It does seem important for a couple notes. One, there's not right indicators and wrong indicators, right? There's many ways to construct these, and they all have different purposes and say different things. The decision to use only primary school students that are enrolled in school certainly has some pretty significant limitations. Does anybody on the call or in this meeting want to address any of the things that could be missing from an indicator constructed in those limited ways? So some of the things for us to consider, GCNF has made the decision to use what we consider the least conservative, or excuse me, the most conservative approach, which is that we're concerned about kids' nutrition, whether or not they're in school. And so are looking primarily at a population within the entire country, not wanting to limit to just those to schools. And we might wonder what happens when a coverage indicator gets to 100% and only reflects primary school aged children who are enrolled. We're missing an enormous set of children. We might be missing those who are refugees. We might be missing child soldiers. We might be missing child laborers. We might be missing orphans. If we think about SDG 4 as around inclusivity, we do need to ask ourselves those questions about how do we ensure that all children are the focus of our attention and not just that those who have the privilege of attending school. Let us open the floor and have other discussion on this topic or others.
So I would have a question here. So why would you consider, if the objective is about all children, that this is suited for SDG 4 and not SDG 2? Because in my head, this is also something like that is worth considering, right?
Yes.
Are we interested in the nutritional status of all children, in which case even the distinction primary and secondary education is not necessarily relevant, because you want all children as per what is a child, right? And you want to look at their nutritional status independently of whether they're in school or not, which to me would be under SDG 2, right?
Yes.
Then if the question is about equity and inclusion in education in school, equity and inclusion in education, then the question of who can learn and under which conditions in school is a question that is being asked under SDG 4, right? And that's where we're coming from. So we're not saying that it should not be monitored. We're saying that it should be monitored. The question is where and under which international mandate.
Very good point. So you've illustrated the point perfectly in that it comes back to the objective and the purpose of what you are trying to measure. And you've described perfectly how it fits within SDG 4. As we all know, the school meal, the intervention of school meals crosses many SDGs. And so you have essentially articulated a technical a piece that goes into constructing the indicator. Other comments on this or others?
From Rwanda, we have already said like this school feeding, so it is clearly understood that those students who are coming to school or enrolled to school are receiving the school meals. It is not like among those in the community, So why are we like again going back to the overall children there? Can you please clarify on that?
I had trouble hearing the question. Were any of the panelists able to hear the question?
I think asking for clarification, Sangeeta, please correct me if I'm wrong, but kind of going back to this point that school meals are, by definition, they're aimed at schools. So why consider out of school children when measuring the school meal coverage? I might have misunderstood that, but that's what I think was said.
Yeah, that is what I exactly mean to say. Otherwise, it is like, the definition we are talking about is like the enrollment rate. Like, if in ideal situation, all students coming to school with school meals, then the thing we are talking here reflects to the enrollment rate also, no?
Yeah, exactly. Yeah.
I'm seeing some a great note in the chat from Ann Sellers of CRS, who's unable to come on, but is indicating that both or multiple indicators might be needed, both understanding how many in-school students are receiving meals and how this compares to the entire population. And a comparison of both definitely helps understand how we're getting close to SDG 4, which is ultimately about expansion and reach, serving all children with education, as well as about the quality of services provided to them.
Sorry, it's Mary McKenna here, and I'm not quite sure how to raise my hand or do that sort of thing, so I'll just I'm just jumping in. But Mary McKenna from Canada, working with Amberley on these projects, and I had put a note as well saying that if within a country it seems to me that the people who do the, who organize the program are going to be most interested in data that addresses the reach of the program. So if the program is targeted to all public schools, then they're going to be wanting data that is about all public schools. And at the same time, that can make it difficult to compare across countries. So I agree with Anne that it may be, different indicators for different purposes. The other thing that I would say is that now that you have good coverage of 155 countries, think that you said that participated in the report, maybe it's also worthwhile to go back and look at the best quality of data kind of that you obtained and the most robust numbers that you obtained. And so from a practical implementation standpoint, use that information to also guide kind of what might be an overall kind of common indicator that could be used.
Excellent. Thank you. Thank you, Mary. All right, we are over time, so let us do one more question. Carl Mueller, please come on the line.
Hi, thanks, Heidi. Very, very interesting, all the guests and the input. I'm going to come from a slightly different perspective. We are a small private foundation that do in-school feeding, and often our measurements are influenced very much by what's the message out to donors. And I hope I'm not rambling too much, because it's actually the session today has sparked some ideas. This idea of horses for courses. What is the correct type of measurement for different types of things that we want to know? And we're always wanting to know how many meals have been served. Yeah, and we measure this by different provinces in the country, that plates or spoons that have come back or things like that. But what would be very interesting for me is internal measurements about program efficacy. We've got very good information on the adequacy. We serve a fortified breakfast program, so we've got very good information on the adequacy of the meal, but the impact of the meal, where's that kind of deeper impact? Is it in the enrollment? Is it in the late coming? Is it in the dropped absenteeism? Is it in the school results? But this is, gives us something to think about as an organization. In our suite of measurements, which is very simple at the moment, we might need to be giving more attention to refining that, because of course, information on program efficacy feeds back into operations and hopefully makes things better. But information that can be used externally helps us sharpen our fundraising efforts.
Very important point. Thank you. Thank you very much. So this was an outstanding conversation, and I suspect that there is much more to be said. We had the idea to hold it. We were eager to have this conversation since we sit in our offices and have these conversations independently a lot. We were really excited to think about engaging all of the experts on this call, those who were panelists and all of you who have attended as well. We want to continue to engage in discussion around this. Again, there aren't right answers that we're trying to get to. We're just trying to help understand the complexity and what we need to think about when we're constructing and when we're interpreting coverage indicators. There's a possibility that this conversation and this webinar could be the first of a series if there is energy and excitement and interested in talking about other school feeding indicators that we would like to discuss as a group as well. So please be in touch with us. We welcome your comments. We welcome your critiques, and we welcome all of your ideas for opportunities for collaboration and working together as well. Please be in touch, and thank you again, everyone.